If you are preparing for the OET medicine speaking test, there is one card that strikes absolute panic into most candidates: the patient refusal. When an interlocutor says, "No, doctor, I'm not taking that medication," or "I'm refusing the surgery," most candidates fall straight into the student trap. They panic. They start reciting textbook facts, listing side effects again, or worse, they practically beg the patient to cooperate, saying things like, "But it is very important for your health." This is an instant fail in clinical communication. Why? Because you are trying to force compliance instead of investigating the clinical reality. A senior clinician handles a refusal with curiosity, not defensiveness. Instead of fighting the patient's no, you must pivot immediately using the ASE Framework. First, analyze the situation. Your clinical goal is no longer to get immediate consent. It is to discover the barrier to consent. Second, script your response with a high-level discovery phrase. You can use this exact language in your next role play. "I hear your concerns, and of course, it is entirely your right to make this decision. To help me understand and provide the best care possible, could you tell me what's worrying you most about this treatment?" Finally, execute with a calm, non-judgmental tone. By validating their autonomy first, you disarm the patient. Only when you understand their fear, whether it's a past bad experience, something they read online, or worry about side effects, can you actually address it. Now here is where most candidates get confused. Validating a refusal doesn't mean you just give up and move to the next task. In a real clinic, and in the OET, you have a duty of care. Once you've used your discovery phrase and understood their hesitation, your next step is to negotiate safety. Instead of pushing the original treatment, you pivot to a safety net. This proves you are still managing the clinical risk, even if the patient is non-compliant. Try saying something like this: "I respect your decision not to proceed today. However, because your safety is my priority, I'd like to suggest a follow-up appointment in 2 weeks so we can monitor your symptoms together. Does that sound like a reasonable middle ground?" This demonstrates to the examiner that you are a clinical leader. You are respecting the patient's no while simultaneously protecting their health. That is the hallmark of a grade B+ clinician. Remember, the OET is a safety exam. It does not test your ability to force a patient to agree. It tests your ability to consult safely and professionally under pressure. Stop playing the student. Start commanding the room. If you are ready to identify and fix the communication mistakes that are holding you back from your grade B+, click the link below now to take our free 60-second consultant gap audit. I'll see you in the next video.